All right. Great day to you, Angela. I'm
Hmm.
excited about today.
I am too. I am too.
It's some heavy stuff, but it's also some fun stuff, and I look
Yes.
forward to the top 5 or 10 of whatever we decide to do. I love it that we don't have
Yeah, I
everything
like
locked down.
those. I like those.
Unhealthy is that's what it's going to be about
Yeah.
because it's a big thing going on with healthcare.
Yeah, it is. In light of what happened to the United Healthcare CEO, um, now I'm going to say 5 to 6 days ago, the CEO of United Healthcare was gunned down in New York. So yeah, in light of that, that's gonna be our focus topic for today.
Yeah,
No, we're going to focus really on the how you as a individual, how do you view your health? What do you to what extent do you go for your health? Just to stay healthy.
yeah, because it is related to life, health, and life, and any lost lives. We sorry for that, for anything for that, for families and all that. But
Exactly,
also, it's very sensitive
it is.
because it's related to a topic of so many. When we talk about healthcare, the healthcare aspect of it is related to a topic where so many families and friends, our people, our health and life is in the balance.
Exactly.
And it's money. It's a big money thing. That business.
Yeah, and for us, what it means for us, for Christopher and I. Now, Christopher, our age, I'm just saying, people. Well, anyway, let me just say, I will be 50 next month, and Chris is already 50. But what does it mean for us being Gen X? We're Generation X. We're approaching. Well, I'm approaching my 50s. What does that mean for me? How do I care about my health? How does Christopher? There are things that I should do. We have to, but we'll just have discussion about that and perhaps encourage you to feel the same way.
I mean, we are discussing it now,
Yeah.
and the thing is that I feel like it's less of a concern when I was younger,
Right.
and it should have been a concern then. And there's no blame. I could say, well, it wasn't something you heard about a lot. Yes, you had physical education in school, but you didn't really hear a lot about it in school. It didn't. The medical and the focus was different, and all those things were kind of like fun visits. They try to make it fun, so you don't like, I don't
Yeah.
want to go.
Yes, they do.
Yeah,
Yeah. Go ahead.
yeah, and so I I just feel you feel more infallible. Even when you did get hurt, you didn't think much about. I didn't even go to the doctor. One time I got my leg clipped. I think it might have been cracked or broken, but I didn't even go to the doctor. I just I missed a little bit of school because I was walking around on hopping around on one leg, and
Excuse
after it kind of healed itself, I just went on to school. So it wasn't even something that was pushed, but at the same time, it still would have been on me as I got older, as I take care of myself to make sure that I start looking into that closer, which I don't think I really did until I got a little older.
Yeah, and in this day and time, more young ones you see are having to have these procedures done, or their health is not where they want it to be. You see a lot of young people with older people problems, heart problems. Talk about diabetes. That's a huge one, the diabetes, where they require medical, attention, and there are things you can do as far as diabetes, but I know that's something I'd have to deal with. And like you said, as a young person, that's something we didn't, for me too. I wasn't thinking about
Well, you
that.
hear it, but you don't know what all it is about. You hear blood,
Yes,
sugar. I got that sugar. I got diabetes, but you don't know the validity of it. You don't know the levels of it until again, unless you educate yourself or get older. And some people act like it's just part of the deal,
yes,
but it's really not. That comes back to why we're so much on trying to eat right, trying to make sure that we don't overeat in foods that really is considered bad, overindulging in super greasy or sugary foods and
exactly.
things like that, because those things can increase those chances, whether we like it or not, versus if we eating more vegetables and more fruits and more healthier things.
Yeah, and we're gonna have to disclose some things to you guys now. Christopher and I are getting over some type of respiratory
Yeah.
infection. I don't know what it is, but I've been
It's
sick for
going
almost
around.
2 weeks, and I'm sure you hear it in our voice.
Yeah,
But
it's going around
yeah, so
in the country. So
and what they've been saying from what I'm hearing that's going around in schools, our granddaughter is in fourth grade. She does go to, she's in school, she's around kids, so she brought it home, and it just spread throughout the house. And for 2 weeks, our home has been somebody.
hot
I've
spot.
had, yeah, we got a hot spot here.
Hmm.
Myself, Christopher, my daughter, my granddaughter, my son-in-law, and my son. He hasn't really been affected yet, but
He
we
was,
he
but
was just a little bit.
everybody, even now we're both, I've still got sinuses and stuff, but the soreness and some of the stronger things have kind of faded away.
Yeah,
But everybody's dealing with it differently because our immune
yeah,
systems respond differently. That's another thing people got to remember. It's because, oh, so and so is okay, I should be okay. But everybody responds differently to sicknesses and viruses and unhealthy eating and all those kind of things.
yeah. One thing I want to also bring out, they're talking about kids with walking pneumonia, so that's
Hmm.
how serious it is, and that's different from COVID. But COVID, I think it spread quick. But with this, it just seems like for example, my granddaughter, she got it. She had a few days. Then 2 3 days later, I came down really hard with it, and I'm
Hmm.
still suffering from it. But we got, and one thing I want to talk about, like back in the day, we didn't have the virtual visits or from your doctor. Like you can, because I know they're busy. It seems like it's a lot of people in these doctors' office that you make an appointment and they schedule it 2 3 4 months out. But with the virtual visits, you can tell them what your symptoms are. You can let your doctor know, hey, this is what's going on with me, and they can just send a prescription, straight up. Now, back in the day, that didn't happen. So at least in that part, I'm glad that we were able to get some medication, but it's slow and go right now. But we're on the what you call it, the recovery phase of this. So we're on antibiotics, and also some other stuff to help to control the cough and all that other stuff. But what I want to say is it is so important to take care. Like we're like Christopher and I, we know how important it is, especially getting older. So you follow our channel, you see all the different things that we're doing. We're doing the walking, juicing, which we got, some good things coming up with the juicing. So stay tuned for that. We really, are ready for that. So we probably give you a little information. But if you're not following us, please follow us on this channel. Please follow us on our Instagram channel. That's spice.olh.life. That's on YouTube. I'm sorry, that is on Instagram, YouTube, Spice O Life. And also Facebook is Spice O Life. And so is TikTok, Spice O Life. So follow us and you'll be able to follow our juicing journey. So I'm gonna, if I haven't already, I think I'll put those somewhere so you guys can see. But also the link will be in the description below as well.
Yeah, all healthcare is not created equal. So in the United States, it's more of a business. In other countries, it's free. And then in some countries, some parts of it is free, some part. So depending on where you are, and in some places, it's just hard to even get it. I think the way it works here is that whether you have it or not, people you gotta by law be taken care of. Like so, if someone comes in, busts into an emergency room at a medical facility, and you gotta by law they gotta still take care of that person. But that doesn't mean they're not gonna have some kind of debt hanging over their head if
Yes.
they, depending on how everything is covered for them.
Yeah.
So it's kind of weird that when it comes to your own life, you still gotta pay. But
Yes. Yes.
it's when I because growing up in that situation, you don't think much about it. But when you start realizing as you get older that all the circumstances are different all over the world and all over the globe, you start realizing how interesting that is.
But you remember too that our grandmas or our moms had little special remedies they had for us, especially in a situation when you got a cold or got the flu or had a fever. There are little extra things that they did that wasn't, they didn't require any medication. Some it just was simple stuff that they used. But I don't remember even getting sick much back in the
Yeah,
day as
or
a
it didn't last
child.
as long.
Yeah, it didn't last as long. It's just different in this day and time for some
Hmm.
reason. We
So,
have a lot more pestilences, a lot more things going on.
hmm.
But yeah, certain things, that they do with garlic and lemon and honey and and ginger ale.
Yeah,
Ginger ale.
and some
But
wild turkey now, man. But the stuff, they have some good stuff that would literally knock a cold out of you
yeah.
for real.
So
I'm not going to mention any of those ingredients on here, but the simplest one is lemon, honey tea, lemon honey tea. That's a
yeah.
good one.
Yeah. So
But
that's what I know. I drunk some lemon honey tea and that helped pull some of the, mucus out of my system because there's a
ugh,
lot of mucus that needs to come out. And I
yikes.
hate I hate that part of this recovery stage because that just makes you sick all in itself because it's just coming out and it's like you just want some peace and I want peace and solitude when I'm sleeping or throughout the day. I'm just getting tired of coughing and whatever and other stuff. So one of the things that I want to bring out too is how me approaching my 50s, how important it is for me to get to my goal weight. And I know it is for you as well. So we're going to, you know, continue on in that journey because we have lost weight, But what we're going to do, I know I haven't asked you this yet, but what we're going to do probably next week podcast or we'll say the next podcast is share with you guys because we're going to start back on our, plan because we got disrupted by this illness,
Yeah.
and how much weight we're losing and how much, just kind of give you more updates in that. So we're gonna start that back the next podcast. We're just trying to get ourselves back together, doing the show and kind of get back into our routine.
So this is the time of year, especially if you live on this in this area where of region of where we are. It's winter,
Yeah.
so it's colder. So this is where it's even you gotta kind of hang in there even tougher and say I'm still going to continue with my exercise regimen.
Mm-hmm.
Even if it was outdoor related activities, you gotta find a way to do them at a gym or to do it indoor
Yes.
and continue to do it. Most of ours consist, of course, of walking. We believe in the power of the walk. So highly recommend trying to use some sort of treadmill because um, being out in very cold weather, especially with everybody getting sick as sick as we got, and just all the
Mm-hmm.
stuff is out there. And I'm not going to try to play doctor and narrow it down because it could be, respiratory issues, pneumonia, flu, any of those related things. Cold does not help it. So now this is even more important if you guys are trying to stick to that. To right now, start looking at that treadmill and seeing how you're going to use it, or just some indoor activities.
Yeah, and we got a couple kind of treadmills, which I'm glad. I just recently bought the standing desk treadmill or walking treadmill where I can have it in my office and I could be walking while I'm working. And, we have this in there. So while that makes it easier. I just got it like a few weeks ago before I got sick. Haha.
Mm.
But that's a good thing for us to do because if we can't get out there, which we really love to be outside, then that's one thing we do, the treadmill. And also, too, the strength training, too, Chris, that's something we need to get back into. But just keep in mind that there are walking treadmills that you can get or purchase that will help you along in your journey. Just explore your options.
Yeah, very true. So we were looking at unhealthiest or skinniest is what the top 10 would consist of, but it's really more of a malnourishment. Or it's
Mm-hmm.
the body mass index, so it's like low amount of fat. Some people may say, well, that's a good thing, a bad thing. Well, it depends on if you working out or something. If are you a bodybuilder, you may have a low body fat, body fat mass. But It's not supposed to be like that naturally.
So
So
you're talking about skinny as far as in an unhealthy state,
yeah, maybe.
meaning like malnutrition
I
type.
think some of them may be. I
Because
don't know if all top 10 of them would be, but I
or you
think
just saying that or we just doing this is what you talking about low body mass, what you call it, body yeah, the body mass index is low
yeah, and
compared to
it may not even be.
may not be a
It
mal.
could be healthy or unhealthy.
Okay, gotcha.
That's
Okay,
the
I
thing.
just
I
want to
don't
know
know.
what to
So
because
when
I'm
you hear
thinking about some
when you hear
countries.
some of the countries, you may say, "Oh man, they really healthy," or you may say, "Man, they really suffering." I don't know.
They are skinny compared to other places. Like now, I know we did some unhealthy ones
Yeah, I don't. So I'm not.
where the body mass was bigger. So yeah, I see what you're saying. We
You
just
and
doing the
some of these.
opposite.
Forgive me if I. So, do you think you know of any?
I know I'm gonna say of some. I'm gonna hypothetically guess some based on my knowledge of the overall,
Some of these,
population.
yeah, some of just be how do they eat,
Right. Okay.
not but
Okay. Go ahead. Read the.
okay. So we won't get anything from you this time.
What you mean?
Never mind.
I'm ready. I want
Top
to ready to
10
guess.
is well, you didn't guess any, but I'm going to tell
I'm
you.
ready. Say the top 10. What? Tell me what the. Read the title of it, and then I'll, let me know what number
Top 10
10.
skinniest
The top 10 skin is. Okay.
countries.
Countries. Got it. All right. Go ahead.
Um,
Number what?
Number 10 is
Wait. Can I?
I can't even pronounce it. You won't guess it.
I won't.
Oh, you
Okay.
trying to guess the 10 as I go?
No. Go ahead. No. You say. So I'll let you know if I want to.
Burkina Faso.
Where in the world is that?
Burkinafaso. It
I've
must be
never
a.
heard of that. Now, is that in? Well, I'm gonna tell you what's on there. What I think is on there. I think that like the Asian continent,
Mm-hmm. Okay.
India, India's on there. Mostly the population there is vegetarians,
Okay.
and I think China is on there. I think that Japan is on there,
Okay.
and all the little islands like Vietnam and Korea. I think
Okay.
they're on there too.
All right. Number 9 is Niger.
That's Africa.
Mm-hmm.
Really? Oh, I forgot those. But yeah, go ahead.
Number 8 is Bangladesh.
Yes, that's India.
Okay.
Well, you talking about these are
Number
cities.
number it's not a country. Bangladesh.
Country. It is a country. I'm sorry.
Number 7 is Malawi.
Malawi. Is that? Wait a minute. Is that Africa? Okay, go ahead. Keep going.
Number 6 is Burundi.
Okay. I think that's around
Eritrea is number 5.
Eritrea.
Eritrea.
Okay.
Eritrea.
That's Middle East.
Number 5. Number 4 is Rwanda.
Wow, another Africa. I didn't
Number
even think
3
about
is
Africa.
Ethiopia.
Oh yeah.
Okay. Number 2 is Uganda.
You got nah.
And then number 1, you mentioned it in the mix of all
Yeah.
what you said, Vietnam.
Vietnam. Okay. You did not. You
And
did not
when you
mention
hear
a
me say
China
Vietnam, you gotta assume it's only
one.
because you don't know they don't have
That's
they
true.
keep everything hidden in the north.
But you know what? And you
So
got to
south.
think, of a small body index. What consists of their
Well, you know
foods?
what?
If you talk about the Asian or the Indian country, I already told you about India, but those
Actually,
little.
that might be North Vietnam.
When you think about there, some of their foods consist of seafood. They do have like I say surf and turf, but they have just certain, they probably eat more of certain kind of foods. I can tell you that they, they're not consuming a lot of processed stuff, from what I'm trying to get at. But yeah, that one was a good one.
Here's the joke, the dad joke of the day.
Dad joke. Wait. What?
If you can
I'm gonna say
stomach
what?
this, you might have to up your health care after listening to this.
Excuse me, everybody.
What did the judge say when a skunk entered the courtroom?
What did the judge
I think I might have told you this one before.
No, I don't remember what did the judge say when a skunk enter
I feel like
the
I've
courtroom.
maybe it was with Jordan or somebody. Or we were talking all in the room.
Okay, a skunk
I do
court
remember having a conversation about this,
courtroom.
but you may not remember it.
All right, skunk is a skunk stinks. Skunk smells. This one is hard, guys. I know I was able to do the other one. This is gonna be so corny. I can just tell. So what did he say? I give up.
Odor in the court.
Oh Lord, odor in a. Yes. Okay. Or
Oh,
odor in the court. Odor in the courtroom.
order.
Oh, 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 oh. Well, that
That
was
was a
the.
stretch,
Yeah, that was a stretch, but
but
good. Thank you for the dad joke.
just the extra one. What what happens when you eat bad seafood?
What happened when you eat bad seafood? Uh oh, I don't know. Wait. No, okay, go ahead.
You feel a little ill,
Wah wah
but there's no
wah.
electricity.
We need some sound effects here, guys, for these dad jokes. Well, thank you for that joke plus extra dad joke.
Yeah,
Um,
but I really wanted to people just to really look at that. Again, we're not professionals. We're not economic advisors, and we're not doctors. But it's one of those things that I wish that I had thought about earlier when it came to my health care and making sure my coverage was right, or my children covered, or my family covered, or the husband covered, and the wife covered, or just your own personal health, and looking at where you live in whatever country you're in, because some countries they try to really push it and make sure you take care of yourself, and some of them don't. But regardless of that, you gotta start. I would say start initiating visits early,
yes, yeah.
whether it's some kind of mandate you have to do or not. Start looking at visits and getting checkups early as they allow. Some people, it used to be back in the day for us like 60, now it's moved to 50 and 40 because but people say, hey, you living longer. Well, that's because people are getting wiser and checking and finding out more about. Now, you see, we just had this scare where we find more about virus and diseases than we ever did.
Yeah.
But that doesn't mean we should take everything for granted and just rely on somebody to tell us to do something instead of taking initiative to do it ourselves. It's a big deal with guys. Guys don't do it as often as I think I see it in the female
Yeah, so some of the things I
world.
know as being older, there are things that we had to do at a certain age. You have to make sure, I think it's 43 or 44 for a colonoscopy. For a woman getting older, it's a mammogram, having those yearly visits with your gynecologist, also doing physical checkups with your primary care physician just to make sure everything, because when you have those physicals, Christopher and I every year we they take blood samples and they test and see how the cholesterol is, what the blood glucose level is. When you don't do that and you just think about, and then some things I'm doing extra is I got a CGM, continuous glucose monitor, on to monitor my blood glucose, and plus I do have one of those little blood pressure device, because there are two things that runs in my family: high blood pressure, and also the diabetes. So I don't have either or, but I can tell you when my weight is at a certain point, those numbers get to a concerning level. So I know that losing weight, eating right, like reducing my carbs. I'm not saying that I'm gonna stay completely away from sweets, but I have to manage that better. And I can tell you that I have improved my tolerance to sweet or sugars. So, having more glucose friendly foods and managing that is pertinent for me so that I won't, have those concerns. But also too, when you're getting checked every year, your doctor can share with you some things that needs to be done for you to improve those numbers if those numbers are high. And cholesterol is a huge thing. It's like, how can you control that? Like in this, I don't know why, it's like you try your best to control those numbers, but then sometimes you got to be prescribed some prescription,
I think
you
knowing
know.
what's in it, again, not educated and not reading more about it, but I didn't even realize till I got a little older that there was cholesterol in milk, whole
Yeah.
milk. I didn't know that until I got older. I learned a lot about milk. All I was told is there's vitamin D and it's got calcium and it's good for you. But I found out it doesn't have the best cholesterol in it. And there are some things, certain fishes and stuff that have good cholesterol
Mm-hmm.
or fatty omegas that you need, and it's bad cholesterol. So I would say research that. Look further into what's good and bad cholesterol, and then look at make sure if you when you're doing your doctor's visit, seeing if you hadn't had one done in a while, do a check and they can tell you where those numbers or the range of where those numbers should be. If if you don't have to take any medicine, please don't. I would recommend you don't. But if you have it in it can be genetic as well.
Mm-hmm.
So it could be a thing that runs in the family, which can also lead to heart disease. So the quicker you can kind of check into that, the better it would be for you.
And also keep in
And
mind,
this is a guy that has a history of high cholesterol. So that's why I'm
yeah.
telling you that.
And I think yours is hereditary because,
Partly, yeah. And part of it is because for a while, growing up, I just didn't even know
you see,
stuff I like had cholesterol, a lot of cholesterol in
so
it.
with
But once I got wind of it and did the things I just mentioned, it went down, and now I'm in the range I should be.
you see, when you know what's up, then you're able to address it and you won't have concerns of having to deal with major issues down the road because like if I know if I can control something and I can, handle it before it gets bad, then I won't have to worry about a insurance claim being approved or denied. But also
Yeah,
too
that's another
that
thing. You can be denied a life insurance or a certain amount of life insurance because you have high cholesterol. It happened to me. We got
yeah,
denied a certain amount of life insurance because of the fact that I had, as a very young age, had high cholesterol.
yeah. And I don't know how sometimes they know, but I think these insurance companies and these medical records, I think they have access to your medical records, but I don't know that for
Oh,
sure.
one time a nurse came out and checked it. I remember she came out and checked and said,
Yeah, that's
"Whoa!"
right, they
And we
did.
was what I was in my 30s then.
That was a long time ago. That was over 10 years ago.
But my point is that if they want, they can just come check it.
They can before they do it. But yeah, let's take care of ourselves, everybody, and let's be let's do this challenge. Let's get healthy, and if we'll encourage you along the way because we're doing the same thing.
Yeah,
Well, there's been another show, another one down.
yeah. Thank you for joining us at the Spice Soul. This is
Oh,
Chris.
this is Angela. Spice O Life. Bye bye.